Hey everybody, my name's Anthony,
And I'm Chris.
and this is Red, White, and Blue Life. So, this week we decided that we're going to talk about COVID and the new mandate and kind of everything that goes along with that.
Yeah, hopefully you're not tired of hearing about COVID just yet.
Yeah, so first we want to talk about really COVID itself and things that go along with that, but we're really going to be hitting the mandate hard towards the end of the middle to the end of the show, so make sure you stick around for that. Yeah.
Yeah. So we've all been living with it here for about the last 2 years. You've all been impacted by it one way or another, whether you're working with it or you're not working because of it, or if you unfortunately lost a family member or know someone who has. It's impacted every aspect of our life.
Right. So basically what it boils down to is COVID sucks for some people,
Definitely for some.
but not for everybody.
Nope.
And that's where we're going
We're
to...
survivors.
We're survivors.
We are
We
COVID
both-
survivors.
We both had it.
I got
I
it early.
Yeah, I got it pretty early too. And I really didn't have any lasting effects. My smell never really came back to 100%. But other than that, everything's gone.
Yeah, same. That was the scariest part for me was, will I ever be able to taste food again? That was a legitimate concern.
Oh, that was.
But unfortunately, some people do have it a lot worse,
Yeah.
especially if you're over 65, which we will talk about here shortly.
Right. We don't really want to downplay the importance. I mean, we're both nurses. We both work in the medical field. We've seen the bad side of
Bad,
COVID.
ugly side of it.
And it definitely does have a bad, ugly side. It's just not for everybody.
Yeah. So, yeah, unfortunately last year, we had 0 visitors, at least at our hospital. I think that was probably most of the country. So, we were there in it, and I remember like the day when I got it, I was like someone was like in distress. I'm like, I should probably just go in there, and they need help right now. And I was like, I could be okay with that. I just hold my breath real quick. They just need their CPAP just adjusted, and it was like a couple days later, I was out. I was like,
I didn't even know I had it. I went to bed, and my wife touched my back or something, and she's like, "You feel really hot." And then I checked my temperature, and I had a fever. Lo and behold, later I felt pretty shitty for a minute,
yeah,
and then I lost the taste, and that was no good.
yeah,
Do you still have the stats pulled up of just the ages?
yeah.
Yeah, cool. So let's go into that a little bit. So COVID overall, it still stands that the younger you are, the less severe COVID overall is. Now that seems to be changing a little bit with the Delta variant and some of them that are coming out, but overall it seems like the younger you are, the better you are.
Which is just like any other basically respiratory illness.
Besides like RSV and stuff, but we won't get into that.
Yeah. But this is, let's see, under like 17, which makes up roughly 8, 10, 15, 22% of the population. They all have less than 0.1% chance of being fatal. So, quarter of the population right there is going to be okay. Obviously, they're young, healthy for the most part. You don't have comorbidities, but your body reacts faster. It still can produce cells faster, so you can heal faster. So, that's basic biology.
Yeah,
So,
biology.
Yeah. So basically, the big point here is going to be the 50 to 64 in age group and up is when it actually starts to kick in pretty high.
It looks like that's where like 85% of the deaths, a little bit over 85% of the deaths occur from 50 and up. But I mean, I feel like that's kind of where most deaths occur naturally.
Yeah.
50 and up.
So obviously the biggest hit here is 85 plus. I mean, at that point,
I feel like you're already signing out almost.
yeah. I mean,
It doesn't make it any less sad.
You have an uphill battle.
It still sucks.
It's tough to see.
Overall, the older you are, the more precautions you need to take. And that kind of gets us into the whole vaccine part of the talk anyway.
This is the juicy part.
The juicy part. Most people who really need to get vaccinated are the people who are most vulnerable, which
Makes
I feel
sense.
like is the oldest population, which is the people who were able to get the vaccine first overall.
Right.
We line them up first and
anyone who has contact with them.
and anyone who has contact with them. But really, not so much.
Yeah, we got healthcare providers got it pretty early.
Yeah,
Or
but
providers, healthcare workers in general. We got ours.
I'm
option to
talking
get
about
ours.
the necessity, really.
Oh,
Like how the shot is going to affect you as a person. The shot doesn't. I mean, it does prevent you from getting it, and it definitely lowers your chance of getting very ill from it. The stats show that basically out of the 178 million people who have been hospitalized now, there's been about a little over 14,000 cases of hospitalization or death after being vaccinated. So it greatly reduces your chance of having to be hospitalized or dying. But the reality of it is, if you are scared, go get your vaccine. The vaccine works. It does protect you. But I mean, if you're not scared of it and you're a healthy person, I don't know if it's really that necessary. No matter who you're going to come in contact with.
oh, I mean, I wouldn't say is it necessary. Does the risk outweigh the reward?
But the shot protects you. And this is a big issue I had with the mandate when it came up, especially during his little speech. Is he talks a huge portion about how much this vaccine works and how well it protects you, but then says that everyone needs to get vaccinated to protect the people who are already vaccinated, which makes no sense.
Well, if you go the efficiency rate of how efficient is the vaccine,
It's pretty damn efficient.
definitely efficient for reducing the effects of it and hospitalizations and deaths. But what's the reinfection rate comparatively to not having it, which is I have the figures right here since we're talking about it. It's a not peer-reviewed study, but it is coming out of Israel. And they are saying that people that had the double dose of the vaccine have a 13% or 13-fold increased risk of breakthrough infection with the Delta variant compared to people that have just gotten COVID the first with no shot.
So are you saying that you have a bigger chance of getting it more than once with a shot?
Yes, by a factor of 13.
Well, that seems kind of shitty.
Yeah.
Okay, I didn't know that part. Yeah, so I'll just go through some of the CDC facts of the vaccine and its effectiveness so far. For people who have received both doses, it reduces the risk of being hospitalized by 94%, which is pretty significant, I would say. It also reduces, it prevents people from getting infected with healthcare workers, first responders, and other essential workers. Those who were fully vaccinated were 90% less likely to get infected, and that's even with how much they are exposed to the disease. So that's still a significant number decrease, especially for people who are face-to-face with it every day. So overall, those who want to get protected from it, it's available, it's free, it's easy to get. So I don't know how this mandate really is going to change anything, because first of all, most of the people who have already received it are the people who are most susceptible to it.
Makes
and
sense.
most susceptible to dying and getting really ill from it. But overall, it's not. It makes no sense to me. Why do the people who are not vaccinated have to get vaccinated to protect the people who are vaccinated?
Well, it could be read as when you live in a society, you have the moral obligation to help the people around you and protect the people around you.
But they're already protected. That's my issue. Is the COVID vaccine reduces the risk of severe illness by 95%, 94%, according to the CDC. So if you have it, you shouldn't be worried about the people who don't have it because you're protected.
Yeah, but
that's like buying a shield. I'm going to use this shield to protect me. But I need my neighbor to have a shield to also... It just doesn't fucking make sense.
I mean, you want to have a strong... It depends on I guess morals, your empathy for other people.
It has nothing to do with that.
Like you want to get your vaccine so you don't transmit it to other people.
It doesn't prevent you from transmitting it to other people. So the way vaccines work, the way vaccines have always worked, it's kind of the same way that your natural immunity works.
Just not as good.
Just not as.
I'll read that here
natural.
in a moment.
We'll get So the way a vaccine works is we introduce a very, very small, most of the time deactivated version of a virus or whatever you're vaccinating for, and your body recognizes that small piece of protein and learns how to fight it and combat it. Same thing happens for natural immunity. You get the disease through natural processes, it spreads and you catch it, and then just like with the vaccine, your body's introduced to it, it produces cells that learn how to fight the disease, and then therefore next time you're introduced to it, it doesn't, your body knows how to fight it already, so it's not as bad, it's not as severe. So that's the way COVID vaccines work, and that's the way all vaccines work. Therefore,
well, they also have the new mRNA one, which is people. That's what I think where people were freaking out about, which we can talk about here in a moment. But changing people's DNA, it was a valid concern.
I feel like we're heading down a conspiracy hole now.
Oh, I got some conspiracy.
There's a lot of conspiracy.
I got some, but go ahead.
But let's try to stick to the facts.
Okay.
I don't want to jump down a conspiracy hole because there's conspiracies about everything.
I got some good ones, but go ahead.
And they're pretty deep. And if you go down those paths, you'll get lost forever. But that kind of brings into the question of why natural immunity isn't being talked about with all of these vaccine rates and infection rates in general. I mean,
well, yeah, to talk on that real quick, just to go back to this Israeli study, I just want to read the conclusion here. This study demonstrates that natural immunity confers longer lasting and stronger protection against infection, symptomatic disease, and hospitalization caused by the Delta variant of SARS-CoV-2 compared to the BNT162 two-dose vaccine immunity. Okay. Individuals who were both previously infected with SARS-CoV-2 and given a single dose of the vaccine gain additional protection against the Delta variant.
Okay.
So
really what it boils down to is the natural immunity is pretty good so far. There's not too many studies on it, besides apparently this one, but I tried to find some information on it. I couldn't find any very reliable sources that were saying that there was lasting immunity or just any studies that were done, but there was a study that comes out of the NIH,
which is the National Institute of Health,
that says that the immune systems of more than 95% of people who recovered from COVID-19 had durable memories of the virus up to 8 months after infection. So that brings me back down to how the immune system works in general. Just because you don't have active antibodies running around your bloodstream doesn't mean that your body doesn't know how to infect or how to fight off the infection.
Right. They still keep I believe you still keep like a little bit in reserve, and when it comes in contact with that, your body boosts up production of the antibodies.
They're called the T cells, memory T cells.
Oh,
yeah, I remember that. Yeah, so those memory T cells, they have basically a long-lasting memory of almost anything that you've come in contact with. And anytime that those T cells come in contact with something that it recognizes as a danger, it goes back to your immune system and tells it to create all the antibodies to destroy whatever it is that's infiltrating your system. So with that being said, natural immunity really should be considered as immunity. I mean, I'm not going to talk about his business here, but like I said, I personally got COVID. I have not received the vaccine yet, and I never caught it again. And I come into contact with this almost on a daily basis. And I think that's just because of the repeated exposure to it. My body has continued to create antibodies to fight it off. I never got sick again.
Yeah. So why don't you think they are not just our work, but why don't you think other places the government is accepting natural immunity as a
I don't know. That's my issue. I don't get it.
I don't understand.
Natural immunity should be a big part of the
As I said,
conversation.
we're getting dosed 3 days a week with COVID.
Yeah.
So, I mean, especially when a patient comes in, just failing to mention they have COVID,
For sure.
and then you're in the room.
I had a person a while back who came in for like a hurt ankle or something random. And then all of a sudden they ended up having COVID. And if you don't know that they're COVID patients, then you don't, gown up like you see on TV. It's
Big old trash bags.
big old trash bags. You don't know. And also the people that are coming through the front door, and it's just not the same. And you get exposed to it on accident all the time going out to the grocery store. I mean, it's everywhere.
Yeah, I'm just thankful it's not like Ebola, or we would be long dead.
Well, the weird thing about it is all of the statistics that we have, most of the statistics that we have, don't account for the people who are asymptomatic, which there's probably a lot more cases than we actually know about.
Maybe that'd be a hard one to.
It's super hard.
Unless you're
Think
testing
about when
everyone.
Think about when COVID first started. Everyone was super, super scared because everyone that we found out that had it died.
Yeah.
Right. They were thinking that the death rate of this thing was going to be over 50% because anyone that you found.
They were also older, I feel like, though, too, when it first.
Sure.
I think even the first literature came out saying above 65, you're at an increased risk.
Yeah.
But it's just.
But that's
general
also
science.
because we just didn't know anything about it.
Right.
And you only know these things if you gather the information over time.
And we weren't getting too much information from.
Absolutely not.
No, they weren't. And then there's the whole issue: do you believe what you're reading from them over there? And then they weren't being too forthcoming with.
I mean, they still aren't. There's actually some information coming out about that. I want to do some more research about what China said, but I haven't. So let's get into the mandate itself. The mandate itself is now saying that any company with over 100 employees has to have everybody get vaccinated
Yes.
or face fines.
The employer faces fines, or the
The
person?
employer faces fines.
So they're definitely not going to want to pay that. So they're making sure everyone gets it.
Oh, for sure.
Yeah.
I think, no, I got to look up the numbers, but I want to say it's like $1,000 per person.
That was 14,000.
14,000. It's 14,000. That's the next part. So in the mandate, they're also mandating that all employers give their employees paid sick time when they get the shot. Just in case you do get sick. You get sick time that's not coming out of your PTO bank to go and receive the shot. And if they deny you that paid sick time to get the shot, they get charged $14,000. In that case, they're going to give you the paid time off. I'm
Yeah,
sure.
they're not going to take that hit.
I don't know many people that make $14,000 in a week.
Oh, I'm sure there's some OnlyFans out there. Some real entrepreneurial type people.
Yes, but
Yeah. So with the mandate coming from OSHA, they're going to be cracking down on everyone here. Definitely, I know hospitals, all the ones in this area are pushing it now.
well, that was before the mandate came out.
That's true. So
A lot of hospitals are heading that route just because we're exposed to it on a daily basis and we have to get it. So, I mean, I'm going to get it. I've heavily relied on my natural immunity, and it's worked great for me. But I'm going to get it here shortly, actually.
yeah.
I'm kind of waiting.
Let's wait till it's the PTO.
I'm kind of waiting to see how the PTO thing rolls out. Maybe I can get some, a little sick vacation. I got a new baby at home.
That's true.
So, some paid time.
Listen, you gotta do what you gotta do. You gotta
Some
keep
paid
everyone
time
safe.
off to hang out with her might be fun.
Yeah, so with the mandate coming out, and the people talking about it's going to go to Supreme Court. I don't
It's
know.
never been done before. You've never had a
there's
federal entity mandate a vaccine for everybody.
Not even with like MMR, like measles, mumps, something like that.
So-
what about? And that's another thing I wanted to talk about was we already have mandated vaccines.
For sure, we do. In workplace and in schools,
Yeah,
there are mandated vaccines. So I don't know.
I had someone
if
bring that
that-
up to me, and I'm like, "Have you seen a picture of someone with like the mumps?
Yeah, that shit's hardcore,
It is awful.
right?
Polio?
Paralyzed children are no fun.
No, like I understand that,
Right, and it totally makes sense, and I get it if they want to make it part of schools. I don't know.
Do you get it?
I do, only because of the ones that are already there. But then
I get
I
it
don't
for
know.
if you have family members at risk.
They should be vaccinated already.
Yeah, but you want to reduce any sort of transmission that someone else can give them.
But they're protected.
They're yeah, but it's not perfect. So if you have a 90-year-old grandma at home, I don't know if the shot's recommended for her, but say it was, they get it. They're protected to a point.
Yeah.
And then say if a kid at school, if you don't want them to get it, you want to protect them against getting it, so they don't. You want just it's one more just barrier to protect grandma, to protect Gam Gam. You want to protect Gam Gam?
Okay.
So if the kid gets the shot, less likely to get the vid, as we call it, and they're less likely to get. That means they're less likely to transmit it. If they're less likely to get it, this is for Gam Gam.
All right.
It makes sense. I'm saying I can see it, but should it be mandated?
I don't know, man.
Yeah,
I don't know. I feel like
this country's built on individual liberties,
right.
but you also have to protect the population. So you got to find that balance. I don't think we found it with this mandate, but
No, this is definitely not the way to go. But I can't think of any other circumstance where they make it a law that you need to protect other people personally as a citizen.
I don't know.
I just can't find it.
I mean, there's definitely other vaccines that are mandated, but I just think they're actually a real threat.
Yeah. I mean, COVID is a real threat for some people.
For some, but if even you could just go and looking at it, I mean, people were saying they are having the long-lasting, effects of it. Like the CEO was Chick-fil-A, ended up killing himself because he had like the really bad tinnitus in the ear, and
I didn't see that.
oh yeah,
The CEO of Chick-fil-A because of COVID?
Yeah, you talk real quick and I'll pull it up so we can.
So I'm just kind of having a hard time with the mandate part of it, just because, I mean, we're a free country. How can you force anyone to put something into their body? It just seems a little bit off to me, a little bit off-putting, I would say. I think if you're worried about it, you should take the precautions to protect yourself. Maybe make your grandkid wear a mask around Gam Gam.
You're not wrong.
I mean, I don't know. That's just my take. The whole mask thing in general is kind of a joke to me too. Especially with the cloth masks that everyone takes off their face and it sticks in their pocket when they get out of the store and then pulls it out and puts it right back on your face. You're not protecting yourself from shit ever.
It was. I mean, I can only speak from like when was it Jayco? I forget who came out. They're like, "Oh, you can use a scarf to protect yourself." You say your whole organization is to protect nurses, and you come out with you can use a scarf.
Yeah.
Like, there's a reason that we're supposed to use N95s.
Right.
That we didn't. That we were reusing for a while. You got to make sure it was in the back, facing the right way, which is supposed to be a one-time use object.
Yes.
Before COVID, it was come out of the patient's room, throw it in the trash. Now it's like we're gonna bake these for a little bit once a week and hope for the best here.
It just makes no sense.
So that's why I'm like really glad it's not Ebola. We would all be dead.
For sure. If Ebola had the infection rate of COVID, it'd probably be the end of humanity.
Well, I don't know. We had like a COVID scare or Ebola scare for a while.
But which is true, but it just didn't have the infection rate that COVID does, which is why it didn't turn into something. If it did, there would have been no stopping it.
And yeah, we wouldn't be here to bring you this podcast.
No,
it was before my time, I think, though.
Not like anyone watches.
Oh, it was Texas Roadhouse.
Texas Roadhouse?
CEO.
Oh.
Says tonight is contributed to his death. Here's what we know about. So there's definitely complications that can arise from it. Luckily, I've been fortunate enough. I don't think I have anything until I get like a massive blood clot or something one day. But
to be honest, most people that have had COVID have been fortunate enough.
That's fair. That's fair.
Yeah. I don't know. I saw this one video You probably saw it too. Of the guy who walked into the meeting in a full bee outfit.
No.
Yeah, dude. He walked into some kind of
A bee outfit with the screen.
with the screen and everything, and he's like, "Look, I have a 0.0001 chance of getting stung by a bee today, so I decided to wear all this shit." Oh my gosh,
Yeah,
it was funny.
But then you get the people like, you see that lady that was just in the supermarket coughing on people.
I would have to punch you in the face, like, but that's based off of something different,
Like,
not even because of COVID.
Yeah, you're not gonna kill me. That's just super disrespectful.
Super uber
I don't want your
uber disrespect.
I just don't want your germs on me, no matter who you are.
Absolutely not. If you got in my face and coughed in it,
Yeah, she ended up losing her job, which probably still isn't enough. Like
she deserved to get punched in the face.
yeah, that's a fight on site, sort of. She makes the
100%.
list. She makes the list.
Oh my gosh.
So our lockdowns here, they seemed a bit excessive to people in this population, but that's not the worst the world's seen.
Absolutely not.
So next up, we got Australia. They have taken it to a new level. So it looks like they had 1,000 fatalities, and they went full, some would say, martial law. So New South Wales Health Minister Brad Hazard, if that is his real name, said police. I don't know where to put the emphasis on that one. Said police would be checking whether people were within a 5-kilometer or 3-mile radius of their homes, as permitted under emergency rules.
And like the cops are beating the shit out of people for it.
The police and military personnel have for weeks been patrolling the streets of Sydney, issuing fines for those contravening health orders, such as wearing masks. So you have
Issuing fines is pretty light compared to what I've seen.
you seen people getting?
I've seen videos of people getting like rocked by police.
You know why they can do that over there?
Why?
They don't have a Second Amendment.
True that.
So
I wouldn't fly here in Arizona.
here's the thing.
I'm not saying we go around shooting cops. We don't.
No,
But
but there's a reason. I don't know if it's as bad as they're making it out to be, or if it really is that bad. But I don't see that flying here.
no.
If you have, you want to create civil unrest, bring in the military to tell people they can't travel 3 miles from their home. I just don't think that would fly here. I think they got to know better than that. But they also don't have. What are they going to do? Protest, yell very loudly, saying "I don't like this." They don't have. They
don't even have the right to protest. They took that away too.
Did they?
Yep. Google it.
Wow.
Google it right now. Australia right to protest is gone because you can't be 3 kilometers away from your house. How the fuck are you gonna go to a protest?
In your yard. You hold
There's
signs
one
in your
dude
yard.
holding a sign in his yard, yelling real loud.
I'm really mad.
Yeah, it's gonna make a big difference. Did you? Oh my gosh! Speaking of the whole Second Amendment thing, I forget what state it was. Man, I need to start writing this stuff down if we're gonna be doing this. There was a state. It's one of the southern states where the congresswoman was like. It's one of the lowest vaccination states there, and they were saying that they were gonna, the government was gonna send people out to the houses just to knock on the door, collect some information, and say, why haven't you gotten your shot? This is important.
Mm-hmm.
And she was like, do they realize that our Second Amendment rights here, we take them real seriously? And I don't know if we're gonna take too kindly to the government knocking on our door asking us about the shot.
It do be like that at some places.
It does. Some people are pretty out there.
So I can't see where they got their protest resolved.
All right.
Or taken away. So that needs to be fact checked still.
We'll fact check that.
But Australia has now reached nearly 73,000 COVID-19 cases and a death toll of 1,000. So only 1,000 people comparatively to ours, which is what, 600 and...
Well, what's the total population of Australia? I'm asking you too many questions.
Australia population.
Either way, it's got to be a lot more than 1,000.
25 million.
And they've lost 1,000 people.
I don't want to say it's a bit excessive. That sounds pretty excessive.
That does sound pretty excessive. There was a Middle Eastern country, too, that went on full lockdowns because they found like one COVID case.
I mean, if you want to stop something, I mean, it's effective.
For sure. I mean, maybe.
I would say.
The thing about Australia, though, is they relied heavily on the fact that they're completely surrounded by water. And they thought that if we just shut down transportation, we're not going to get this.
Well, I mean, living on an island, makes sense.
It does.
Once everything resolves.
But you can't 100% cut off transportation to and from your country.
So I have something by The Guardian here, which is everything you need to know about, looks like New South Wales Road to Freedom, as it's being called. Ooh. Which I believe we fought our Road to Freedom in 1774, something like that.
Please tell me that was a joke.
Yeah, Revolutionary War. That was our Road to Freedom.
You said 1774.
Well, okay, so it's like around there. What was it? That was some Declaration of Independence. We'll make that independence joke. When was the Revolutionary War? I'm not a historian here. You're about to Google it.
1776.
No, that's when we signed the Declaration of Independence.
Yeah.
That wasn't the Revolutionary War. It was before that.
Okay, I guess I see what you're talking about now. I thought you were saying... Never mind. I'm sorry.
Take it back.
I take it back.
So stay-at-home orders for adults who have received both doses of COVID-19 vaccine will be lifted on Monday after they achieve 70% double-dose vaccination target. Okay. However, let's see. So under the plan announced, the freedoms would come into effect 6 days later following the Monday of...
The 25th of October.
25th of October. So what, if you are vaccinated, what are you allowed to do? So... They're going to allow you to go into other people's homes, nice. Only up to 5 visitors, but they have to be fully vaccinated.
Okay.
Up to outdoors, up to 20 people allowed to gather.
Okay.
Allowing them.
Nice.
So you
pubs, restaurants,
yeah,
cafes.
Up to 1 person per 4 square meters.
So we're gonna give you a little tiny bit of stuff back.
Yeah. To the. Oh, let me go. I feel it's.
Where'd they gonna get all the police to enforce that?
I don't know. I'm assuming they have them.
But like at every store, every restaurant.
Maybe it's
like gonna be to do with the clicker.
Maybe reward people for telling people on their fellow countrymen.
Kind of like with the abortion one. There's gonna be like a bounty system.
Oh, dude, it's.
If you want to know about that, we talked all about abortion last week. Go check that episode out. $10,000 per abortion reported.
Yeah. So basically, crazy. What are you there? You have to ask permission to do anything or
ask permission.
I mean, they're telling you what you
can do. Are they gonna get a spanking?
Including what's according to you, the police are spanking them over there.
There's some videos out there. Google that too. I'm just kidding.
Yeah. So Australia went full lockdown, but I mean, they want to reach their target, then I guess you get your rights back.
Yeah, I guess so. I don't know. The whole thing is just kind of crazy, especially with just how serious COVID really is, and that kind of brings me to Bill Mayer of all sources. Now I'm a little bit late on this news. This happened back in April.
Oh.
But Bill Mayer had a little segment on his show discussing how outrageous the reporting has been on COVID as a whole, especially on the left side of the aisle. All the left-sided media sources have just blown this up to be the most dangerous thing in the world. Which is happening on both sides, but really, really more so on the left. So there was a Gallup poll that was asking what the current chances of being hospitalized with COVID would be. And 41% of Democrats said that it was 50% and higher that you would get hospitalized. And the next group was 28%. So almost 70% of Democrats think you have from a 20 to a 50% chance of being hospitalized with COVID, when the real answer is between 1 and 5%. Which is still a significant number, but 50%?
Well, I guess, I mean, I get, yeah, kind of sometimes you got to see the questions, because if that's right for a certain age group. If you're talking about 90-year-olds who get COVID, they're going to get hospitalized, but not the average person. So I guess it.
But this was the question on. The question was just, what are the chances somebody with COVID must be hospitalized?
No.
And they said 50% and up.
we wouldn't have any hospitals.
No, we don't have enough hospitals for that. Republicans, believe it or not, were the highest group to get the answer correct. 26% of them said that it was between 1% and 5%. And then independents said 20%. And only 10% of Democrats got the answer correct at 10%.
That's interesting.
Did I say only 20%?
You said 10, I think.
Okay. Anyways, 10% of get Democrats.
That is a Freudian slip for you.
Sorry, not really. 10% of them got it right.
No. So basically, you just weird. You just gotta like find the middle of them. Like
Find the middle of 'em.
Average amount is what? That's still way too high for even.
Still way
What's
too
the
high.
middle one right here?
That's Republicans.
Oh,
They had the lowest group of people. Let's see. It says 28% of them thought it was 50% and above. And that's just because all over the news,
you're just hearing how bad it is.
constantly,
It's the end of times.
always, no matter what you open up, unless you like exclusively watch Fox News and only read the headlines where they're talking shit on Democrats, then maybe you get lower percentages, but it's just...
Yeah, and unfortunately, with mainstream media, that's the only thing that's going to capture attention.
Yes. He also talked about in the same little snippet here, he talked about how most countries report a decent amount of good news, whereas 87% of our news from any source is bad. We only post the bad shit.
I wonder why people are depressed.
That's why people are depressed.
Yeah.
Every time you turn on the TV, you're just seeing the whole world is falling apart and dying. It's crazy.
Yeah. And just to touch back real quick, we're not making light of the subject here. I mean, we do see it firsthand. We were there when our hospital was at capacity and we're taking the ICU holds and the overcrowding. Like, we see it. We're not making light of it. But it's a real threat. But our job here, is just to tell you what's going on in the world and, give you our view on it. So, not making light of it, but I definitely don't think it's blown up as bad as some of the outlets you're hearing are telling you. Like, it's definitely bad some places, but
For the vulnerable people.
yeah, which unfortunately in America we don't have the healthiest lifestyle, so it's going to be worse in some demographics.
For sure. My standpoint on it is, if you're worried about it, you should go and get your shot and wear your mask. If you're worried about it.
But don't make me.
But don't force me to. That's
It's
it.
my life. It's my risk, I guess. you could
Protect
say.
yourself. That's what we are based on.
Yeah,
Protect yourself if you feel like you need protected.
that's fair.
Don't go to Disneyland.
If you have like COPD, asthma.
Yeah, you know what I'm saying? Like, it's not the job of the general population to protect the few. That's how I feel.
I like it. Makes sense.
All right, well, that pretty much wraps it up, don't you think?
Yeah, I think we hit all the salient points.
Yes. So, if you like what you heard today, don't forget to like the video, share it with some people, because our last video didn't really hit as hard as we thought it was going to. We enjoy doing this stuff, so we're going to keep doing it either way.
We'll be here.
So, next week, we're not 100% sure what topic we're going to hit. We're going to be watching the news and see if something big drops. But we would like some suggestions from you guys on what we should talk about next.
Let us know what you're interested. Let us know what you're interested in, and just drop some comments below. Something that you think would be interesting to hear on your drive home. And otherwise, we're going to come up with something on our own, and you have to deal with it either way. So
right now we're available on TikTok, Rumble, YouTube, and we're still trying to figure out the whole podcast thing. That's showing to be a little bit more difficult.
it is not intuitive.
It is not that easy to do.
But we'll figure it out. Everyone stay safe. Mask up. Get your shot. Get your double shot. And get your triple shot if you're feeling it.
Triple shot? The booster shot?
The booster. The booster to the booster.
That's a fourth shot.
Fourth shot.
Get all your shots
get
if
'em
you're
all.
worried.
Yeah.
Just don't make other people get their shots.
All right, guys. Have a good week.
That's it.
Later.
Thanks.